Welcome to the BeaconWay podcast, hosted by award-winning executive team of Beacon Media and Marketing. With over 3 decades of experience, Adrian, Jennifer, and Ken give you an insider's view of what's working, what's not, and what's on the horizon for digital marketing. Grow your business today with the BeaconWay podcast.
Hey, welcome back to the BeaconWay podcast. This is Jennifer, your host, and I have Trevor Colhoun. Am I saying that right? Trevor Colhoun?
Colhoun, yeah.
Oh, okay, great. With TPN Health Trusted Provider Network, and really excited conversations today. We're going to get into some serious meat that we have not really talked about on this podcast before, but has come about in a roundabout way, which is what is going on in the behavioral health market? Why are there so many issues with insurance? Why are there so many issues with people finding the care that they need? So we've got those two issues on those sides. And then even the other side that we see from the marketing side, why are there issues even getting the right people in the door? So my perspective when I was talking to Trevor here just a little bit ago is that everything seemed mismatched. So the people that are trying to get the right people, that are trying to get the insurance, the people that are trying to get the care, all three feel often mismatched to me after being in marketing for 12 years and working in many industries. So Trevor, I'd love you to share just a little bit what we were talking about of why you started TPN, what problems you've seen in the industry, and then how you guys are solving it.
Thanks. I think it's been a great conversation so far, and I'm excited to continue it on. Look, I'm a human being, and I've had loved ones and myself go through behavioral health journeys, and getting a front row through that process, you start to understand and see the frustration. And I think that frustration led me and other people in our company to start to see what is the problem here and why is it this way? And ultimately, without hiding the ball, the conclusion for us is this is not presenting a value prop, meaning the entire ecosystem of behavioral health. And if you take a triangle of these parts, you've got the client that comes in and enters into the behavioral health market and has no idea who to see, how long to see that person, and when they get recovery. And if they don't, and they can't answer those questions, they don't understand what it costs. And if they don't know what it costs, they're not going to engage. Okay. So there's not a lot of transparency in terms of the lay process of recovery. But that isn't just that. It goes over to the insurance world. The insurance world doesn't really understand the value prop as they take a member through the cycle of a recovery journey. They don't have transparency. They don't have great data. They don't have connectivity. They can't see the marketplace. They have professionals that run this industry and know that there's a clinical process to recovery, but they can't create it at scale. And in the same respect as the service providers, even down to the individual provider, so to speak, but more the network providers, the treatment centers, the hospital systems, have an inability to articulate the value prop to the marketplace. And ironically, none of this is the fault of all pieces of this triangle. It's just a market set up for years that wasn't ready at the scale and ability to help the end user. And so as we've seen through COVID, this digitization, demand even further increase, you're seeing more and more problems. And I think, Jennifer, we talked about this a little bit, but there's this bubbling up in society of anger, and it's been manifested already on the streets of New York to the executive world of the insurance company. I empathize with them as well because they're extremely frustrated because I think most of the world, and I innately believe this, that the insurance company is economically incentivized to have the healthiest patient they can. They're less economically incentivized to actually deny you and not get you to that healthy space if they can, because you're going to leave and they want you to stay and they want you to stay forever. So they don't have the tools to do it. They don't have the connection. And I think that couple of the shocking things that people don't realize about the insurance world is they have no connection, minimal, with their provider networks. And Jennifer and I, you were talking about this before. It's even people that are providing service to insurance groups. They're saying, I have a provider network. They don't. They just don't. They have a contract with many individual providers saying, I'll pay you $100 at this rate for an hour, $200 at this rate. But what they don't have is they don't know the availability of that person. They don't know how to connect with that person. They don't know how to transfer that provider network to a member network and allow the member to engage with that provider audience. It doesn't exist.
And that piece of it right there, that was hugely eye-opening for me, even from the marketing business perspective, because that is the worst type of transaction from my point of view. You're just agreeing to a price, but like, where's the evidence-based care of that? Where's the information that is a good person that you should be connecting with? And I'm not disparaging anybody in this world, but in my business, everything that we do is judged on value. We have to be able to prove what we do.
Yeah.
And that's most businesses operate that way. I understand it's just business, right? And maybe, do you think there's a piece of maybe we've put healthcare in a different area of thinking that, well, that's not true, because you don't go see a heart surgeon if you don't think they're going to be able to perform the surgery. There has to be some value prop in that. So do you think behavioral health itself is completely separate outside of healthcare? Or do you think it's an issue all across the board?
I think it's an issue all across the board. I think that it's solvable, which is probably exciting.
Yeah.
I also think, we have, as maybe a society, as an industry, have closed the walls to best business practices for a long time and thinking that's the evil way, and we need to lead with the heart. But there is a clinical process to recovery for most diagnosed. Okay. And if I were to go to the physical health world, I'd go see my primary care physician. He or she would hold my hand. I would go get my litany of tests. I might go see, the ENT if I needed to, or the heart or cardiologist who I needed to, whatever was suggested off that. But that process doesn't exist in behavioral health. There are small, micro, at a large cost that people to create that for the half of 1%, but that's something that there's a process that can be started at scale where we can actually elevate case managers, we can elevate care clinicians and care navigators to drive member networks and individual clients through a process of recovery and hold the hand. We have the technology, we just don't have with TPN, we're starting to have the connected network to actually track and follow and connect and engage with providers to drive them through the process of recovery. So if they have XYZ, then they can connect with somebody as that modality work that would bring, and have that care alliance, which is a huge piece in this. That care alliance is a huge piece to bring recovery to that individual.
So from my perspective, you're solving not just, like, when I look at the marketing side of things, it's there's Psychology Today, there's recovery.com, there's Google, right? There's Meta, there's all these options on how to drive traffic or drive people that are interested. And there's a lot of problems with that. I think as you
can we talk about that for a second?
Oh yeah, there's so many problems with it. So yeah.
I mean, those companies there are companies that exist because there's an opportunity. That's great. That's America. Very happy about that. But what they've done is they perpetuated the issue with Google, and they perpetuated the issue of taking advantage of an which is the beginning problem that we talked about. Is I'm an individual. I don't understand the value of behavioral health. I don't know where to go, but I'm in pain and I'm struggling. Okay.
So I'm going to go online and search.
I go online and search. So all those, that starts with the mothership of Google, and then it goes on to, these bespoke companies that have self-curated that traffic to bring to their constituents. And it just is another tax and issue on the market that's not helping it, and it's really not bringing ethical natures into this industry. Now, is there a solution? Because we talked about this earlier. So I spent a lot of time studying the philanthropic world in behavioral health, who said you shouldn't do this. And some groups, I think it was Facing Addiction, actually was responsible for shutting down Google for 3 or 4 months, right?
Right.
But they didn't have a solution to solve it. And we're trying to come with a solution of just flipping this thing on the head and actually giving the power and the driver to the individual provider to actually connect and engage and drive this bus of this market instead of the client. Because the client, I don't drive the bus of my local hospital network and walk in there and be like, I have a headache, but send me the cardiologist because I like that guy. That's not how it works.
Well, it doesn't respect the experts of the field, right?
It doesn't. And then what's really cool, which Jennifer should drive up, this is value. These folks are just as important and just as valuable as the cardiologist.
Right.
Because they're driving issues that maybe even create into the cardiology field, right? And stresses and things of that nature. I'm excited at where this is going in the next 10 years.
I am too.
As we start to drive this problem. But I recognize your frustrations, and we live in these frustrations. We started talking about treatment centers, right? And their business models. With technology, you can start driving down cost. Treatment centers, as I stated and you agreed, they spend 30% of their gross revenue on marketing.
Which is wrong and insane. Like, that does not follow any business model of any company that I know of, except for SaaS, which is a product that doesn't require people on the ground doing a service, right? So every other industry, the average you're spending on marketing is 7 to 10%.
Yeah.
And that's why you see, I think, them hurting so much.
Yeah.
And
hurting so much, but also not able to maintain the level of service that the clients that they want need to receive, because they spend so much on marketing trying to find the clients that they want to fit their facility. They're spending so much money trying to curate and find those clients, and they can't.
Right.
Or they can't match up with the right ones. And the irony that everybody should be banging their head against the walls, there's 60 million citizens that require to enter into the behavioral health market every year, and only 20% of them enter into it because of the first issue. They don't understand the value prop, so I don't trust it, and I'm not going to enter, so I'm just going to live with this issue.
And that is such a disservice to everyone.
Everybody.
Because most of the people I've met in this industry truly care.
They do care.
And they really want to help. And they're just like, how is this not working?
Yeah. And then you go to the hospital system because they're taking on all those people. Why you go to the depression meds, the SSRIs are prescribed mostly by primary care physicians because they can't ethically have connectivity to the provider market to actually discharge a patient into that market. So they're like, look, my patient's in trouble and we're just going to try what happens. We're going to try this and see what happens. We're going to try this benzo and see what happens. No.
Right. Without having that. So let's talk solution a little bit. We talked about this a bit before, which I'll definitely incorporate that into this conversation, but let's talk solution a little bit about driving the cost of marketing down, creating the value prop that actually makes sense for the market. What is TPN doing that's different specifically?
Yeah. So we focus on the provider, and the provider is the nexus of this entire ecosystem. And within our network, which you could think of it like LinkedIn, where the provider comes in, they have a user account, they can connect, engage, refer, endorse each other. But more importantly, where the relationship starts with the providers, we offer them a tremendous amount of continuing education. And so we elevate them and democratize that continuing education process.
Okay.
That brings them into the network. And then what happens is then the engagement can start from the organization side in. So I can take the state of Louisiana, for example, where we have about an 80% penetration rate, meaning 80% of the licensed providers are on our platform, meaning the social workers, the psychologists, the counselors, okay? And before TPN, the state knew that my constituents, because they're a regulatory body, are licensed or not licensed. That's kind of it. They knew their name. Okay. They knew their license, not licensed, with a 90% accuracy. Okay. Now with TPN, the information we have is now I know they're licensed. I know where they are in their licensure process. I know what services they provide, what modalities, what demographics they serve, geographically where they serve. They're people, what insurance networks are they in, which is a big key in this market, on, having affidavits saying I'm in Aetna, I'm in Healthy Blue, on both sides agreed, and have an attestation saying that they're in that network, and having real accurate running data that's continuing on provider networks. And so we go and we'll manage insurance payers networks, self-insured government or company networks. So their members, their constituents can actually have a connective provider network. And then we will engage with case managers to allow them to actually have their provider pool to serve up to, to the audience that they're serving and really help drive the process of clinical recovery. For treatment centers, we can really change the engagement of referral networks and have them build referral networks. We have treatment centers that we have them put in front of 10,000 clinicians this year alone for 87 minutes on average. And those are unique clinicians. So just really increasing the engagement they have with the clinical market, which is a wonderful referral source because one clinician on the ground in touch with 100 to 300 potential referrers to go to that clinician. But those referrals, more importantly, are tailored for their system because they're coming in, getting continued education from that treatment center because they want to learn about said modality that treatment center is doing. And so they will have patients on the ground that actually require maybe those services. So it's really, we see it as a game changer, really just the beginning process of building this network and this connective system.
Really exciting.
I think so. You do. We hope the market gets more excited. We had a great year. We've brought a lot of partners in. We're talking with, as we grow, we're being very intentional. We're talking with the state of New York holistically. We'll just go here. Now I think we're in a place where we're big enough and we've shown enough of what we can do that we can say, look, why don't we just focus our energies on this state and that state and grow out from there instead of just, because it could be a fire hose. It could be a fire hose.
As we're thinking about going into 2025, I guess if you're either a mental health provider individually or you're a center and you're looking at what to do for this next year, where would your mind go on something that we can be focusing on that's positive?
So I think if you're an individual provider, I'd encourage you to come on TPN.health. There's a tremendous amount of education and knowledge you can see just to check your box, but you don't have to, of your licensure, you can do it in a way where you're actually getting trained by top people, which is really cool. And they've got a tremendous stuff on demand, but also think about, I want to build a practice. Okay. I want to build referral. I'm looking for a job. So there's a lot there for you as an individual provider. You are our most important user. On the organization side, so treatment centers, insurance companies, we talked about this in terms of how are you thinking about your marketing dollars and spending them and engagement and building brand and building referral networks and training your internal staff and all the stuff that we do. We do a lot for those treatment center organizations that can really bring down their costs and also elevate themselves as an organization to their staff, which is really cool. And then insurance companies, associations, state governments, think about us. Think about your budgets. Think about keeping the transparency alive so there's checks and balances and know what's going on. I mean, at the end of the day, we are the third-party group, the source of truth of what's going on. And all of these groups are important to us to bring together, bring down their costs, bring up their ROI. This is a business, all right? It is a business with a massive mission of helping our brothers and sisters and mothers and fathers and get through traumas they've had, deal with things that are scary or shameful, but we could do this and we could do this at scale and we could do this in a way that's effective, both to results and our pocketbook.
Love it. Thank you so much for sharing. Thanks for asking. And those were some great things that you brought up and hard conversations, but conversations need to be had.
Yeah. Well, Jennifer, thank you so much for having me. It's awesome.
The recording has stopped.
That was awesome. Could you please send me your recording?
I'll send you the full Fathom.
Yeah, I'll put it all together.
Yeah.
I'll have our editor put it all together. Wow. I did not know this is what you guys were doing. Steve obviously told me and said I needed to check it out, but wow.
Yeah, we're excited to have Steve. He's a star. And
He is. Steve
I didn't know I was recruiting him for a while, but I was. And he's come in and we got to about 42,000 clinicians without spending $1 in marketing. And so now we have him and we're marketing and he is just dynamo and it's just exploding. So it's a little, whoa, but it's great.
Yeah. His reputation, and he's the real deal.
He is the real deal. He's a good person.
Yes. I have been with him since literally year he found me because I'm good at marketing. So he found me 7 years ago when I think this year 2 at the mental health marketing conference, and it was like 100 people. No, maybe 50. But there was something about, I was like, okay, I guess we're going to fly across the country and go meet this guy. And I don't know, like there was just from that time, yeah, he's a very good person for sure.
Yeah, he's a very good person. I'm glad he connected us.
Yeah, thank you so much for the time.
I want to stay connected on other things and how we can help you guys and vice versa and stuff like that and be a part of this. It's a movement.
It is. And we have been avoiding getting in deep with this industry for the last 3 years and finally felt like this year was the year we were supposed to do it because of all the corruption and the fraud and just be transparent about that. But we feel like if there aren't people in it that are doing it for the right reason and really trying to bring change, like then anyway, and you're doing that. So that's all.
Great. Grateful. Jennifer, just so grateful. Thank you so much.
Thank you. Take care.
You have been listening to the BeaconWay podcast. Make sure to join us for new episodes every week. Don't forget to like, share, and subscribe to the BeaconWay on Apple Podcasts, Spotify, or wherever you listen to podcasts.